believe that in order to be effective in risk communication, particularly in public health, you need to have good and reliable information and data. And in the Tell Me project, one of the issues that we'll be dealing with is to evaluate what are the sources of information for risk communication during pandemics particularly. How can these sources be improved, both in quantity but more important in quality? Well, I think there are two components to that. The one is the means of communication, and obviously we will be looking at the social media and the less conventional means of communication that haven't been used widely until now. And also we'll be looking at the actual messages that we convey in the communication. So we'll be looking at different target groups to look at their needs, their perceptions, and what will be the most effective way to get the information that is reliable to them so that they can understand it and comply with our recommendations, or with public health recommendations. We have a number of tasks, but the main tasks that we have are basically to set up the framework model for risk communication, working with our partners in the Tell Me project, identifying the different risk groups and what kind of information or what kind of risk communication they require. We'll be evaluating the sources of information, particularly the sources that are available on the internet, but also other sources. And we will be then looking at the ways in which we can actually interpret this in terms of what we call a threat index, so that people can get a very convenient and understandable threat index to know where we are in terms of any kind of public health emergency, but such as a pandemic.